Assalamu alaikum, Honorable Minister of Health, Director General Health Services, all my colleagues, Dr. Shirani, Dr. Bayo, our EPI Program Manager, all the colleagues, ladies and gentlemen, media friends. It's great pleasure for me and a privilege for me to be here, stand before you in this wonderful occasion to say a few words. Uh, Let me first appreciate the response to flood situation by the government of Balochstan. Particularly, the Ministry of Health was extraordinary, I should say. That was really great to see. Most of the places where flood was affected, healthcare staff was there, healthcare workers were there, DG, Secretary Health, Honorable Minister, they have visited and ensure that people have access to essential healthcare services. In that, WHO has played a main role. We have set up a hub in Nasirabad hospital, and that's to look after 6 divisions. And also, we have set up emergency operations center in Kila Safulla as well as Las Bella. I have visited all these districts and with our teams from the first day, and we started to support the government of Balochistan, the Ministry of Health, to ensure that people are getting essential healthcare services. So many times we have donated medicines, we have donated equipment, and also we involved with disease control. And today, if you look at, there was cholera outbreak, there was acute watery diarrhea outbreak, and then the malaria outbreak due to floods. All are very much under control. Cholera now no more cholera cases have been seen for last 2 weeks, and OCV or the cholera vaccine campaign was started for the country in Balochistan, I remember, and the whole hierarchy led by the Honorable Minister has played a great role there. When it comes to acute watery diarrhea outbreak, it is very much less now. Malaria is also again number of cases have gone down because of the intervention. All the diagnostic needed medicine all were sent to these hospitals, healthcare facilities to ensure that people get the best treatment. So today we see disease trends are coming down, but still we are worried because still stagnation of water is there. So we need to continue our efforts. And also malnutrition is another area where we need to focus. WHO supporting to establish more than 30 nutrition stabilization centers. Also, we support to establish and improve the facilities of labor room, the Ministry of Health, and also 15 million worth of medicines to treat people. And an entire donation is worth about 65 million Pakistan rupees. So we are very much pleased and happy to support the people in Balochistan, and WHO vision is to ensure health and well-being of the people. So thank you, Honorable Minister, for giving us opportunity for to come and do all this work. And I am very much thankful to my team, the polio team, our Dr. Shirani and the team, EPI team, for involving so much with the healthcare workers. I think we all should salute to all the healthcare workers. Some of the healthcare workers' houses were damaged, their families were affected, but still they were working like frontline heroes and supporting the people. So we all should salute the healthcare workers for the commendable work they have done. And I really appreciate the Honorable Minister, DG Health Services Secretary, and all the hierarchy in the Ministry of Health for their dedication and commitment. And media friends, I think you have done a great work highlighting issues and get the government authorities to focus on that. Thank you so much. Have a nice day.